For this part, we will be explaining our routing form of the comments and suggestions of the panelists. So the first comments and suggestion of the panelists is rephrase our GONS and specific objectives. So the action taken is we rephrase our GO and added new objective. We changed the GONSO because the previous GONSO is all about the features of the app instead of providing a medium opportunity for healthcare professionals. Next is the panelists comments and suggests that organization that will be responsible for evaluating the application and regulating the caregivers. Discuss how you intend to collaborate with organization or the government agencies. The research and organization that's only in scope area, and we found the ZRE Practitioners Healthcare Association Incorporated. They are the ones who give verification and evaluate the healthcare professionals. Next is the panelists ask about the data about the number of the elderly that can benefit the app. We've searched that the statistics of elderly here in Davao City, which are scope, is 120,000 elderly people with ages 60 years old and above. And we write it on our document. So the next include among the existing solution that the one that demonstrated. We adjust our proposed app by adding to-do list feature that will notify the caregiver beforehand to do during service, which will be explained beforehand during our demo. Next comment and suggestion by the panelists is the testing procedure mentions MAUQ, which was not mentioned initially under testing or evaluation phases of the SDLC model. So the action taken on this is we update our SDLC model by mentioning the MAUQ. Next common suggestion is the the redo of the conceptual framework present only one diagram which caters both care seekers and caregivers, providing explanation of the conceptual framework. The action taken on this is we updated our conceptual framework that both caters the caregiver and care seekers. The next comments and suggestions of the panelists is planning requirements and analysis and designs are phases that are expected to have been done. So make sure verbs are in the appropriate tense. The action taken on this is we also change the different phrases into appropriate verbs and tenses. Next is the comments and suggestion is updating the work plan to follow the SDLC phases. So the action taken on this is the work plan was revised to reflect the iterative design process. The next comments and suggestion of the panelists is in terms of design, how do you intend to present the review for each caregiver? Is it in the form of the stars? When the caregiving service, the action taken on this is when the caregiving service is complete, the client can leave feedback for the caregiver in their profile by adding a comment and rating them out of 5 stars, 5 being the highest. And the next comments and suggestions of the panelists is the how do you intend to develop the app? What language will be used? The action taken on this is the group decides that we will use Flutter Dart for the main programming language. Firebase to store our database of the users and Visual Studio Code as our code editor.
For the next part of the routing form, testing should also cover inclusion criteria. The who is mentioned but how many is not specified this. So we have come up with 20 respondents, which will be composed of 10 caregivers, 10 certified caregivers, and 10 care seekers aging 18 and above who have elderly families in need of care assistance at home. Next part is how do we ensure that minimum health standards are still imposed since we are still under the pandemic. So we've come up with a solution that health protocols measures will be strictly implemented, whereas caregivers will be required to wear personal protective equipment. Next is how are the items in the instrument group? What to do with this letter stand for? So we have already indicated the meaning of each letter in our manuscript. Next part is consider revising to reflect your actual proposal. So we have updated our title to usability of soft care, mobile application for booking home caregiving services. Next is check with your teacher as to what is supposed to be the format of referencing. So we have already updated our format in referencing in our manuscript. Next is we are tasked to add caption. We are we are tasked to add caption to all images if and acknowledge the source, same in the black box texting. So we also updated our manuscript and we have acknowledged and put all caption to all images in the section conceptual framework, design procedure, testing procedure. Next part is include in the manuscript the wireframe of your application. So we have already put our wireframe, our mobile application wireframe on the manuscript. Next one is, will this be the only questionnaire you will use? Which part asked about this using survey questionnaires to measure their level of demand for care assistance and the health provider's acceptance of this mobile application. We updated we have updated the document and we also remove the demand and will only use the usability mobile health application questionnaire. Next is how are you going to handle unfortunate situation, medical malpractices, professional liabilities, and the breach of confidentiality as well. So to ensure this, we have come up with a solution and we have also researched for this that the two parties will be binded by a formal contract of service or a service agreement stipulating the service inclusions, payment terms, resolutions to issues, and other essential terms. So with this solution, we might handle unfortunate situations. So next is we are tasked to provide a table on how you're going to interpret the mean. Basically, you're going to provide the verbal description if ever you are going to acquire a specific mean. So we have searched for this and we have come up that to determine the usability of the application, the questionnaire score is the total score of each item then divided by the number of items. Calculating the average and determining the average of the response to all items. The closer the mean value is to 1, the higher the app usability will be. So we have updated this on our manuscript on our testing section. Then last is I don't see the test cases of the black box testing itself. You need to identify the test. So we have already added test cases on the document on the testing part also. So that's all for the routing form.